And back on the Dining Show, we are pleased to join Dr. Paul Hiss and Dr. Doug Devries, Eye Care Associates. They've been on the show for many years. Pleasure to have you both back on the program.
Thank you, Sam.
Good to be back.
So I have to tell you, my mother recently had cataract surgery at the age of 80-something, and she now has 20/20 vision. And I was just surprised. I don't think of cataract as being corrective. I think of it as being a medical procedure to prevent blindness. But why is it that you can actually see better after cataract surgery?
Well, we usually don't do cataract surgery until the vision is affected. Mm-hmm. So she may have had 20/20 vision in the past.
Never.
Probably did.
No, she's had glasses. Well, yeah,
okay,
yeah,
with
glasses most of her life.
With glasses, and she's 20/20.
Mm-hmm.
Then cataracts develop, and even with glasses, she's worse than 20/20. She gets to the point where she's unhappy with her level activities because her vision isn't as good. Cataract surgery is done. Now her vision is likely 20/20 again, either with glasses like she used to, or if a particular lens implant was used to counteract her need for glasses, then she certainly could be 20/20 without glasses after the surgery. So cataract surgery is usually not done to get out of glasses. It's done when the vision has declined. But when we do cataract surgery, as icing on the cake, we're very often able to get somebody out of glasses that they've always worn.
And you guys also do LASIK surgery as well, correct?
That's correct, we do that. And that would be more as a need, so somebody doesn't need to wear glasses. With cataract surgery, it's been very interesting with the increase in the phenomenal amount of technology, is now cataract surgery has moved to be kind of a combination of refractive surgery as well as taking care of that cloudy lens and getting people back to a better corrected or uncorrected vision, just because of the technology involved in diagnostically measuring the eye and be able to determine which implant and the type of implants that are now available.
One of the things that's amazing in doing the research on you, Dan Gutson and I were working on this and doing the math, is that you've performed almost 80,000 surgeries. That is remarkable.
Well, I've been at it a little while, Sam.
Well, and it's not even, it's Reno, Las Vegas, and rural Nevada. And you're one of the few doctors that actually is going out to rural Nevada. And it sounds like you're still one of the few doctors that's going out to rural Nevada.
I think I go further than just about anybody in the state. We go all the way out to the eastern part of the state in Ely. We go to Elko and Winnemucca as well. And we have the Las Vegas office that I visit every other week also. So I get around.
To say the least, and Eye Care Associates has a fantastic reputation. One of the things that's exciting is the new technologies that are being involved in doing these surgeries, where you can actually look at things in real time, correct?
Yes. So during the eye surgery, we have an analyzer which will let us know how the eye is focusing at that time. It used to be we would need to predict what lens implant would be best for somebody prior to surgery. And that was a pretty good estimation, really, to tell you the truth. Many people have had cataract surgery over the decades and do beautifully well. And if they need a little bit of glasses to see their 20/20, then they wear a little bit of glasses, or maybe they don't need it. But now we're getting fewer and fewer people who still need glasses after surgery, if they so opt to have a lens that costs some money. Insurance doesn't pay for you to have a lens in your eye just because you don't want to wear glasses. But if we're doing cataract surgery and their insurance pays for most of the surgery, patients are more than likely willing to pay some of their own money to have a lens that keeps them from needing glasses. So we're able to measure that in the middle of surgery now and get a better result.
I've noticed as I'm getting older that my eyes are getting drier, and I've had contacts since college. Can you tell me what the benefits are of getting a LASIK versus keeping my contacts? And you know, just it seems like it might be a smarter move for me at this point.
Well, one of the factors that is helping make your eyes dry are the contact lenses. While you'd be losing the contact lenses, then you're also going to have another event, which would be the LASIK surgery that can induce more dryness. So until the dryness is well under control, you'd be ill-advised to have a refractive procedure. If you can get that eye back to a baseline where it's a good tear film and a healthy ocular surface, then you'd be fine to have the procedure. But many people will gravitate, just like you are saying, is, yeah, I'm tired of these contact lenses, I can't wear them as long, I can't wear them as comfortable, so I'd like to have a refractive surgery. Yeah, got to get the eye in good shape before you, and make sure the ocular surface is well prepared before you do a refractive surgery on it.
But I would still think that having just the surgery versus putting an artificial substance in my eye would probably be better. I mean, I would think that just putting in contacts to me is sort of a scary thought every day.
Yeah, yeah. No, it would. You'd think that it would be better to do that, but unless that surface is prepared, you could induce a lifetime of dryness for that patient.
Okay.
Let me ask you about stigmatism, because I know a lot of people say, well, I want to get that stigmatism removed. And that's kind of goofy, isn't it?
Well, there's a big misconception about that, yes. Astigmatism merely means that the eye doesn't focus light perfectly well. If you think of a pure optical structure, like a lens, light goes through it and focuses to a perfect point on the other side of it. A point is a stigma. People who don't focus light to a point are astigmatic, meaning they don't focus to a point. So it's not a point, is what astigmatism means. So when we do astigmatism, we're not removing the stigma, we're reshaping the eye into such a way that the light focuses better to a point. So they're not astigmatic. It's a double negative.
I thank you so much for clearing that up, and we're out of time. But folks, if you need help with your eyes on any level, Eye Care Associates is the place to go, and these guys are the people to come see. Contact drhis.com or just look up Eye Care Associates and you'll find them. Thank you very much indeed. Pleasure to have you here. We'll be right back.